welcome to another Ask Nerida Joy video. I have Shanlyn back with me today. This is Shanlyn's third treatment. It's been about 7 weeks since we have seen Shanlyn. Shanlyn had a lot of thickening, a lot of dryness on the outer level. Prior to this, she also had a little bit of the rosacea, so a very, very, very sensitive skin. A little bit of, it was a little challenging getting Shanlyn's skin to a place where it was staying calm. We had to adjust some things. I've spoken in previous videos about the importance of layering for a lot of skin types. In Shanlyn's case, layering was causing a little bit of a problem for her. So what we have with Shanlyn is she has that oily T-zone, a thickened skin, a skin that's had quite some time in the sun, but also a very sensitive skin that has the rosacea too. And so we really had to, we buffered the skin back a lot, which is great. The skin is a lot smoother. We're not seeing those fine little lines, that dehydration that we were, in the very beginning. Her skin is calmer, it's not ruddy and inflamed. But we really had to not layer with her. The less is better is the way that we've had to do it for Shanlyn. So what we're going to do here is I'm going to cleanse off her skin. We're going to have a really good look at her skin. I'm looking at it though as it looks so much better. Her skin looks more even toned. She was a little bit darker in certain areas. Her pore size is smaller, which is really, really nice. And she doesn't have that ruddiness and aggressiveness that I'd seen previously in her around this area, around the nose and the cheeks. So we're going to cleanse off her skin and bring the lights and the camera over a little bit closer. We're going to zoom in here, have a look and see how much better, on a close-up level, how much better her skin is doing. So here we have our K cleanser, and this again is our non-foaming gel cleanser. It's really nice because it's a really nice cleanser for a sensitive skin, and that's what we want to be working with on someone as sensitive as Shanlyn. Some skin types require lots of change, where you've just constantly got to be changing up your treatment products because it gets used to something very quickly. And often that happens a lot with Asian skin. Is that I have found over the many years of doing hands-on work, 41 years, that I often have to be changing serums and treatment products. They'll finish one and then I'm going to move on over to something else, just because the skin, it requires that. So so everybody's different, and it's important that you understand that we have to treat everybody, as an individual, and knowing whether it be that they're having food issues, whether they're having, whatever their issues may be, we really have to look at somebody's skin and make a decision on their home care regimen that's right just for them. And sometimes that is changing things around very frequently, and sometimes it isn't. So the good thing about it is that we have lots of choices, and lots of different choices in the treatments that we can do as well. So here we are, we're just cleansing off the skin, but it's so much more youthful, Shanlyn's skin. It just looks really pretty, and it's come a long way, so that's great. I'm using my disposable sponges, a very, very soft sponge. Okay, I'm going to do an exfoliant. I'm going to work with the exfoliating mask, which has papaya lemon peel powder and a little bit of glycolic. I'm going to mix a lot of healing gel with that. I don't want to create any sensitivity on her skin at all. I'm going to work a little bit with retinols. I'm going to work with my flavonoid healing gel, and we're going to work that into the skin. So here we are. This is our exfoliating mask. Exfoliating mask. Here's healing gel. We're mixing them together, and I'm going to just be working that into the skin for a minute. I know some people like to use brushes and paint their exfoliating mask onto the face, which is also perfectly fine. I prefer to use my hands over brushes for a couple of reasons. One is that I feel if I'm working it into the skin and doing circular motions, that I'm really sort of working it into a line, or I'm working it into a pore. And I also feel that, you know, when you are busy doing treatments back to back, it's you don't have a lot of time to clean. So, and because cleaning is so important, it's sometimes it's just easier for me to use my hands, and that way I'm not having to worry about having to clean my brushes, which you don't see me using brushes for that reason. I can work a lot faster if I'm using two hands on their face than using a brush and painting it on, and that's going to take a little bit more time. And I usually have a lot to do on somebody's face when I start working on their face, and maybe I've only got 60 minutes or 90 minutes, but either way I like to have my hands on their skin as much as possible. So when you're working with an exfoliating product, you want to make sure that you're getting up here close either side of the nose, because often someone who's a little oily, they have blackheads or enlarged pores quite high up here on the sides. And also when you're working with the nose, you want to make sure that you're doing the tip of the nose and that you're working well around the nose, underneath, above the lip. And it's important because when you are exfoliating the skin, you're exfoliating, you know, and getting rid of the dead cells and the dry buildup. So this one here has that buffing effect on the epidermis, and it is what we call a surface regenerative. So it really sort of cleans up the skin, prepares the skin for the next treatment products that we're going to be putting on the skin. And the up here just above the lip, we want to really make sure, often there's, you know, enlarged holes, little pores, you know, above this area as well, especially directly underneath the nose. You want to make sure you're getting in that little, scooping into that little area here, directly under here, and just sort of working your product in there so that it's not being neglected, and it's an area that often needs a little bit more help. So usually when people put on their treatment products, they're not sort of doing too much to their lip, but it's a really important area to stop, you know, little vertical lines and to certainly lighten up anything that may be there. So we've used the exfoliating mask. I'm going to take that off now. I know in some videos, and I had some talks with Jordan Samuel's Skin on some other videos that we've talked about on his channel. And we've spoken about, you know, using alpha hydroxy acids too much in treatments. Sometimes if you have it in your cleanser, your glycolics, and it's in your cleanser, and then it might be in your serum, and then it might be in your treatment products, sometimes it's just too much. So, you know, be conscious of that. You don't need to have your AHAs in all these products and things that you're putting on your skin, because sometimes you can you can fry the skin too much and you can get a chemical burn, and you have to be very careful. So I like to keep my treatment products to be treatment products, and they're going to be my actives, and that might be things that have your alpha hydroxy acids or your retinols, and those are the things that I really want to, you know, get down to the fibroblast cells and work really well on those different levels. But I don't want to make the skin sensitive in the beginning by having too much of an AHA, and, you know, in a cleanser, in a toner, and in often a lot of these products, they have all of these stronger drying preparations in. So you just have to be really careful. Your kit, your system that you use at home, it has to make sense, in that you can't be too strong in one area and then create a sensitivity or a dryness, and then, you know, it all has to work together. So your esthetician will be able to help you organize that so that you're not going to be drying it out and then trying to combat with some overly nourishing moisturizer. Everything has a purpose, and your system has to all work together. It has to have that synergy where it just all works together. So what we've done is we've put on the exfoliating mask, we've removed it on Shanlyn's skin, and now we're going to start working in our treatment products. Now, remember what I said before with Shanlyn, what she has told me through working with her skin, and we did go through a little bumpy road with her in the beginning because her skin is sensitive, and we had to cut back on some certain things and change things around. So what I'm doing here now is I'm working in the healing gel into Shanlyn's skin. Remember, we don't want to be doing too many layers on her skin, because what we found with Shanlyn's skin is less is more. So I've worked in the healing gel. We've put that all over her skin. Usually at this point, I'm going to be using retinols. I'm going to be using my Q flavonoids, and I'm going to be doing a lot more on her skin. But in Shanlyn's case, I'm not doing that. We are going to just be working in a stronger retinol, which is a professional retinol, not a prescription strength, but a professional retinol. And I'm just going to work that into her skin for a little bit, because what we found with Shani, as I said before, is that her skin is very sensitive. So we really don't want to layer too much with her. We don't want to suffocate her skin. We're going to just work some things in that are actives that are going to take her skin to another level, but not be doing too many different types of things. So this one here is our professional retinol formula. And I'm going to work this in. I'm going to be using some of the healing gel, and I'm just going to work this into her skin for a little bit. Now, if we look back at some previous photos of Shanlyn's skin, you're going to notice that her skin, it looks a lot brighter, it looks more youthful, and this is what we want. We're here to make the skin look better, right? So we want to make it look more youthful, and that is, you know, keeping pore size small, keeping the skin, you know, pretty to look at, look dewy and glowing and healthy. And that's what us Estes do for our clients. So we're going to work this in here for a little bit. I'm going to put some of the eye gel around her eyes. Now I'm just working a little bit of my treatment massage cream, which is really my hydrating mask. I use this one a lot to massage with because I like it. It is very hydrating, and it's not comedogenic, and it's just a really nice massage cream. So it's a nice hydrator for the skin without it being too much on the skin. So when somebody is a little bit oily, you want to make sure that you're not using products that are too nourishing, because you don't want to overnourish the skin. So here we go, we're just working this into the skin. And I can tell Shanlyn's doing a really good job of cleaning her skin too, because her pores are really clean. So that's really great. Cleansing the skin well is really important. And a lot of the time when photos and things are sent to us, I'm looking at them, and the first thing that I'm seeing is, number one, they're really surface dry, so we have to get rid of that surface dryness before you can start treating the acne that might be under there. Or they're really surface dry, or their skin is just not clean, and you can see the blackheads sticking out, so that you know they're not putting effort into cleaning the skin. So you have to put a lot of effort into cleaning your skin, because if you have a clean skin, then it's going to, not only is it going to look a lot better, your pore size is going to be smaller, but your skin's going to be able to accept your treatment products that you're putting on thereafter. So it's just really important to make sure you're putting effort into cleaning your skin really well, and that you're doing those circular motions that I talk about. I have a video that is on cleansing, how to cleanse your skin. It is also on my YouTube channel, so that's something that you know, a lot that you need to look at and make sure that you are cleansing, you're doing those circular motions, you're getting around the nose area, and that you're taking off your first cleanse at home with a warm, wet washcloth, and a clean, warm, wet washcloth every night. So I find a lot of people, they're so worried about their wrinkles, or they're so worried about their pore size, but they're just not cleaning their skin well enough. And you have to clean your skin well in the beginning to be able to get really good results. So put effort into that. Don't be too quick. I'm not someone who recommends toners for people to use a lot of the time. So you do have to put effort into cleansing your skin, and that's why I often mention you have to cleanse twice at night. And if you've been out and about in the daytime and you've got sunblock or you've got makeup on your skin, it's really important to make sure that you're cleansing it off, and that you're doing a good job at cleansing it off. So it's so spend time doing that, and you shouldn't have to then use a toner. A toner again has a purpose, but it's not for everybody, and I don't recommend toners probably for most of my clients, I also do not use a toner myself on a daily basis. So that, you know, they are, again, everything has a purpose. And when you're putting things on your own skin at home, you want to know that it has a purpose for your skin. So we've worked that in for a little bit. I'm going to add a little bit of my massage oil. My massage oil has the gamma-linolenic acid in it. It has evening primrose oil. It is, again, a non-comedogenic oil. It's a very, very light oil. I'm just going to work that in and massage Shanlyn's skin a little bit longer. The skin on her shoulders. The skin on Shanlyn's shoulders is a little bit dry. I did exfoliate down here with the exfoliating mask, and I'm just noticing we're still just getting little bits of that coming off here right now. So we're just working this oil into the shoulders. It's really important to remember to work on the neck and the décolleté. The neck is a really hard area to keep youthful, and I know it's an area that I struggle with myself as well. A lot of the different types of treatments that you can do for the neck, sometimes they melt fat. Some of the different treatments that are out there, whether they're forms of laser or ultrasound, sometimes they melt fat. And sometimes, you know, that doesn't work on somebody who's a lean person. You have to be very careful with some of the treatments out there that they're doing that actually melts fat, because it can cause dimpling. And I know on certain machines that were being done by some of the doctors, and because I worked with a facial plastic surgeon as well, that in his clinic there was a machine that he stopped using altogether because he noticed that it was melting fat, and melting fat to the point where it was causing dimpling. So just because a machine, you know, that they have in the doctor's offices, sometimes, you know, they work fine for people and sometimes they don't. So, you know, it's not, I mean, that's why you sign a piece of paper, and you know, it's, sometimes it works well and sometimes it doesn't. So what I do want to point out to people, though, is that there is a price you pay for everything. And a lot of people don't realize that when you're having different surgeries and you're having things done, whether it be that you're having a facelift or if you're doing fillers, you know, I know of people that have had fillers done that are now blind because of something that went wrong. And I also know of people that have had facelifts that they can't turn their head all the way to one side because it's pulled tighter on that side. So I also know of people that have a lot of nerve damage. And I think what's really important is that whenever you have any surgery, it damages the blood supply to that area. So it's, you know, it's very important that you understand. You don't hear about these things, but I'm telling you because I know and I see and I work with doctors and I know what goes on, is that there's a price you pay for a lot of things. It's not all how one thinks that, oh, you go get a facelift and everything's just wonderful. It isn't always like that. And unfortunately, there is more and more problems that happen as a result of that. So whenever you have any form of surgery, there is issues that can happen. And just from my own personal experience from having many years ago, almost 30 years ago, of having liposuction done, what happened when I had it done, the cannula that went in was very thick, was as thick as my finger. Nowadays it's very thin and it's like a needle. But when I had it done, it was as thick as my finger, and it's a hot rod that goes in as they break it down and suck out fat. And mind you, there was a lot of fat, okay? So it's as thick as my finger, it goes in, and what does that heated rod do? It forms scar tissue. So what you have, you know, when you get older is you have a lot of dimpling, and it's the same with, you know, a lot of the times when you have things done with on the face or the neck, that anything that, you know, that melts fat or creates scar tissue, it's a problem for later, and you don't see it initially, but later in life it causes a lot of dimpling. And it doesn't matter with the enormous amounts of massage I've had to break down that scar tissue, it still causes dimpling. So it's really important, again, that you understand there are prices that you pay when you you have surgery done, and a lot of people just don't talk about it, and you certainly do not hear about it coming from the industry where they're doing it all the time. But I have seen even another one, the cool sculpting, that is done a lot out there. There's a lot of nerve damage that happens as a result of that, and I actually personally have a friend and a client who had cool sculpting done on the tops of her arms, to try to reduce the fat on the tops of her arms. And not that she has a lot, but she had it done, and now it's affected her hands. So it's affected the nerves in her arm, and now she has problems with her hands. So, as I'm saying, it's not all what it seems to be so fabulous, and you just need to know this and really research what you're doing. Make sure, if you are going to be doing things, that you're going to the best doctor that you know of. And you need to be, if you're having fillers done, you don't want to be going to a gynecologist to have fillers done. You want to go to somebody that specializes in that particular area of the face. And especially if you're having something done around your eyes, you want to go to somebody that works with the eye area and that knows this part of the face. So I very strongly recommend that you put time into studying, and just make sure you go to good people, because there are a lot of people out there doing work that they're not great, and like in every industry. So really, really put time and effort into that, because if you are thinking about doing different things to your face or body, okay? Okay, so I've worked in a little bit of the massage oil in here. Her décolleté was a little bit drier, and so we've sort of worked that in there. We've worked in some of the hydrating mask into her face. I'm going to be layering the mask over top of this. I'm not taking this off her skin. We're not going to be doing any extractions here. We've just got a really pretty skin. Her pore size looks great. Her skin looks really healthy. It looks really pretty. But again, we're just going to work in a treatment mask. I'm going to be working it into her face, and then that's a really good thing. So here we go. So what I'm doing, and this is what's so great about what we can do with our products, is you can mix and change things around. So I'm mixing a purifying mask, and I'm mixing it with my hydrating mask, and I'm going to mix the two together on my hands first, and then I'm going to work it into Shanlyn's skin. And sometimes, if someone's a little bit sensitive, they're not too oily, but they have a little bit of oil there, but their skin's either a little bit dry, or you just don't want to strip the skin too much and use a dry clay mask on their skin, even if you're not going to be letting it dry. What's really nice is that we can really mix our masks and add to things and just work it into her skin, so you're massaging in a different base. And that's what's nice, is that we have all these wonderful products that you can really mix and do a lot of great things with, just to customize it for your client's skin. So Shanlyn's skin, as I said, her skin is so much better than it was. But her skin doesn't need a lot. And remember, we are working with somebody who has come back and just sort of said, I can't do a whole bunch on my skin, because if I do, my skin gets irritated. Less is better. And we just have to work with, everyone's skin is different, and there's things that you have to, sometimes it takes a little while to figure it out too. So I myself am not perfect, and always, working with different things, and sometimes it's perfect and it's fantastic and everything works and we get results very quickly, and sometimes it takes a little bit longer. So as I said, everybody's different, and that's what's so great, is that we have the tools to be able to work with the variety of skin types and skin sensitivities, and that's really important. So I've just worked it in for a very short time into her skin, and we don't need to leave it on a long time. I'm just working it in enough until I start to feel it sort of thickening a little bit, and then I'm going to take it off. So we're taking that off. So I have literally only worked this in for a couple of minutes. You don't have to leave masks on the skin a really long time. As I said, everything has a purpose, and this is your canvas to work your magic on. And that can be a little bit of this and a little bit of that, and then voila, it all just works. Now, what seemed to work well for Shanlyn's skin and what her home care regimen has in it is one of her serums that she has peptides in it. And peptides are what we call the bodybuilders in the skin. There are many different types of peptides. You'll see in different products, your oligami, your pantopeptides, there's all kinds of peptides out there that are put into skincare products. But what's nice is that we have a lot of different types of peptides, and they offer a different element to a product. And sometimes, it's not that you always have to go the aggressive or the using retinols or AHAs. Sometimes it's just, peptides are great, and sometimes they work really well for certain people. So it's very important to, again, just to research, to understand a little bit about peptides, how they work on the skin, and just the change and what you can do with them, because sometimes, again, especially with someone like Shanlyn, we need to be changing things around a little bit, not giving her too much, not layering her skin too much. So because she can't layer too much, we want to make sure what we are giving her is really going to be beneficial, and it's going to be helping her skin to take it to that next level. So I'm working some peptides into her skin right now. This particular one is the biorejuvenating, and it's very light, but it has some really good ingredients in it. Very light on the skin, not too much of anything. And remember, we want to keep it light for her. So Shanlyn, thank you for coming back and being here with us again today. And thank you all for being here and watching, and just things to remember and to point out that is really important, just to really try to customize things, change things up a little bit for your clients, especially as you're going into different seasons. You need to do that just to keep everything moving, and so that you're advancing and moving their skin to that next level is what's really important. So thank you for watching another Ask Nerida Joy video, and we'll be back to see you all again soon. Bye-bye.